After years of efforts by the government and its citizens, Japan was able to bend the curve for suicide rates from 80 suicides per day to 55 daily. But the pandemic is nullifying all those efforts. Since Japan's state of emergency was announced, the suicide prevention centers have recorded an uptick in distress calls. Our next report tells you more.
It's just another day in Japan's help center. The phone starts ringing as soon as the suicide hotline opens and keeps ringing off the hook. One distress call after another.
There are so many people that call us who want to connect and talk to somebody. But the fact is there are so many calls and we can't answer all of them.
After new laws, policy changes and massive efforts by citizen and volunteer groups, Japan saw a drop in suicides this year by more than 20% compared to last year. But the pandemic has washed away all those efforts. Distress calls have seen a spike after Japan announced its soft lockdown and a state of emergency. So much so that suicide prevention groups are now fearful that this outbreak could lead Japan back to the grim decade, a time when more than 30,000 Japanese took their lives every single year. That's more than 80 suicides every day.
I think the number of suicides will increase in the future. In the past, when there has been a disaster, the number of suicides spiked. After things calm down, I think what we do is important for times like these.
With so many engaged in combating the spread of the virus, the health facility has fewer volunteers. That is resulting in many unanswered calls. Japan brought down its suicide rate, the highest among G7 nations. The country witnessed a decline of nearly 40% in 15 years. But the current situation is bringing back haunting memories of 1998, when economic despair hit the Asian markets after a sales tax hike. Last year, Japan hit its lowest in 40 years. But the rate of suicide was still higher than in the United States, which has more than twice of Japan's population. The financial effects of this pandemic is sparking fears of joblessness and economic pressure, especially for small and medium-sized businesses.
The desire for suicide increases after people build up stress, being off hopeless.
Experts say that the coronavirus pandemic will have a long-term impact. And the impact will be not just financial and medical, but social too. While the phone keeps ringing, not in one, but many suicide prevention centers, support workers are fearful that the looming economic crisis could turn out to be more than they can handle. Bureau Report, WION, World is One.